All right. So I'm not promoting any drug or steroids, and please do not take steroids and always consult with your doctor in case of using any type of drug that alters your body. I mean, Anavar is very, very popular among athletes as well as influencers on Instagram and TikTok. And today we will talk about Anavar, how it works in your body, and how it metabolizes in your body, what you can expect, and what you would have to look out for to not end up in a hospital on a ventilator. So this one is going to be an in-depth guide. Anavar, known as Oxandrolone, is an oral anabolic steroid, which has gained massive popularity due to its mild nature compared to other steroids. However, just because it's considered mild doesn't mean it's free of risks at all. It's still a very powerful compound that alters your body's chemistry. Now let's break down exactly how an Anavar works, how it metabolizes, and how it builds muscle compared to the steroids, and what side effects you need to watch out for while being on Anavar. So Anavar is a derivative of dihydrotestosterone, which is in short known as DHT, meaning it has been chemically modified from the male sex DHT to enhance its anabolic properties while reducing its androgenic effects. Now, this makes it very appealing to those looking to build muscle without excessive water retention or severe hormonal imbalances. Anavar gives a very hard, dry, and aesthetic look, often compared to Winstrol. But Anavar works the best if you just want to look aesthetic and cool. And Winstrol is used by stage bodybuilders to lean down. Now, Anavar is not just used for gains, but it's also used for treatment of osteoporosis. It was mostly experimented on burn victims, and it worked really well, suggesting it has a very strong healing properties. And as I mentioned about osteoporosis, it significantly increases bone mineral density among people who are low on BMD. And with all this, Anavar also improves collagen synthesis, which heals your joints and is also good for the skin. The gains made with Anavar are mostly lean and dry, and not wet and watery like other drugs. For example, Anadrol or Dianabol. On Anadrol or Dianabol, as soon as you stop taking it, you lose all the gains. Amount of those gains are mostly water, and Anadrol as well as Dianabol crush your testosterone, often shutting down your own production. Now, same is not the case with Anavar. You can take Anavar even on high doses and still you wouldn't see suppression. Now, let's start with the dosage. Now, Anavar comes in a tablet of 10 mg mostly. That's the most common dose in a single tablet. And for women, 10 mg a day is enough without causing masculinization. For example, voice deepening, facial hair growth, and there isn't much risk of masculinizing effects on low doses like 10 mg. For men, if you're just a normal guy being started with PD drugs, the recommended dose is around 20 mg. And when you take 20 mg and see how you respond to it, and later raise the dosage as you like. Most find their sweet spot at around 30 mg to 40 mg. Anything above 30 is leaving the safe zone, as I would say. So don't do that unless you know what you're doing and what you're trying to achieve. Now, Anova has a half-life of about 7 to 8 hours, meaning it leaves your system in a short amount of time.